Welcome to Bostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare. Welcome to another episode of Bostic Health. I'm Bradley Bostic, and I'm thrilled to have my guest, Chris Gandy, here with me. Thanks for joining.
I'm super excited to be here. Yeah.
So Chris and I share a passion for healthcare, and so we're going to talk about regenerative medicine as sort of our main topic, which is a booming business, but also something that folks have firsthand experience with being extremely rewarding and valuable for their lives. And Chris, I think you're one of those people based on our conversation. So look forward to hearing more about that. But in addition to having been an NBA basketball player and basketball star, Chris has taken his talents into business and has built the Midwest Legacy Group, advising folks on how to live their best lives. And that includes health. It also includes, of course, finances. And they kind of go hand in hand.
They do. They do. What we find is that those that are not aligned with health many a times aren't aligned with their finances. And so they do go hand in hand, and you find out very quickly that, you know, the left pocket and the right pocket are not always aligned accordingly.
Well said. So how did you navigate from being in professional athletics to moving into your professional career?
Well, just like most athletes, they don't decide to stop playing. Typically, the game stops loving them, or there's an injury. Well, yeah, there was an injury. And I wouldn't suggest that people Google this that are watching me and you, unless they haven't had anything to eat for the last 24 hours. But I had something called the terrible triad. Do you know what that is?
I don't.
Okay. So 3 ligaments, 1 time, 1 move. It was a sweet move, but that move ended my professional career and launched me down the pipeline of trying to figure out what I wanted to be when I grew up.
Well, it seems like it's worked out. I think things happen the way they're supposed to. But so I suppose the injury probably led to you thinking long and hard also about how do you maintain a level of health that would allow you to live a great life even beyond sports.
Absolutely. That was my first surgery, throughout my entire adolescence. And, my body always worked for me. And, when I called on it, I could perform at the optimal level in college, professionally, and one day it just didn't. And I went under the knife. I'd heard about guys getting ACL surgeries and coming back, but the terrible triad is 3 at one time. And so ACL, PCL, MCL gone, and my ACL. So you're laying one way and your legs point another way, your foot's pointing another way. And I remember my coach saying, "Get up and walk it off." And I'm like, yeah, no, that's not happening. So that happened, and you had to figure out what to do with your life, and it launched me into trying to figure out, I did not want to be the guy out playing with my kids in the backyard and not be able to walk. There's so many former players that their hips are bad, their knees are bad because of all the impact that goes along with playing sports, and the average person doesn't see it, but we feel it, and as you get older, that stops your mobility, that stops your ability to flex and use some of the muscles that help you in your everyday life. So I'm pretty active at trying to make sure that I keep those things going, not only through working out weekly, daily, but also doing some things that, quite frankly, most people wouldn't assume that a big 6'9" guy like myself could do.
Mm-hmm.
Yeah.
Like yoga?
I do yoga. I do some yoga lattes, hot yoga.
Okay.
Those are always good.
I did that recently. It was this intense yoga situation where there were weights involved, and it was 105 degrees.
Yeah.
And gosh, it was harder than it sounds.
Yeah. You realize the smallest person in the room is the strongest, right?
Right. For sure.
There's a lady in our class that actually does 3 classes in a row, and she stands on one toe and lifts all the weights, and you're like, well, how did you do that? Right.
Right.
And but it's just fascinating, the small muscles and how to utilize those to help stabilize yourself and stabilize, how you can function on a day-to-day basis. And really, it's about functionality at this point.
Yeah. So we focus on the business of healthcare
Love
here.
it.
And
Love it.
You're obviously at an intersection of people's lives and business. And it's a lot of your clients are in the medical profession. And I think some of them are in this regenerative medicine boom that's taking place.
Yeah.
I would love to hear more about how you have gotten involved with regenerative medicine, both with your clients and personally, and any kind of insight or wisdom you can share on the business side of it. You know, how are these folks that are doing it right doing things effectively? And then also maybe touch a bit on some of the bad actors, candidly, that are getting some press that don't necessarily follow the right kind of approach to decide who is a good candidate for this, regenerative kind of medicine.
Right. Well, let's break it down. So, question is, how did I get from sports into regenerative medicine? So it's kind of interesting that physicians and people in the medical space are a lot like athletes. I can give you the reasons why. They work really hard, they make a lot of money, they have great lifestyles, and they pay a bunch of tax. Right? And at the end of the day, we try to figure out in our world how to help them create a game plan for life. And by doing that, the physicians just quite frankly made sense. And so we understand the business of medicine is a $1 billion business. And we understand that. And so trying to help people figure out other ways to make money without cutting on people. We've got surgeons, anesthesiologists. We've got people that have been in Western medicine for a long period of time that are now saying that I can make $300,000-$400,000 and I have the most liability with making very little margins. With Medicare and some of the social programs, the reimbursement is shrinking, and that's pretty obvious. And so what's happening is private practices have been gobbled up by a lot of the bigger organizations. And so you're seeing that now. And so if you ask a entrepreneurial type of physician, where's the opportunity to make medicine? It's not really on cutting on people anymore. It's figuring out how they can partake in some of the other revenue streams that come through medicine. And so regenerative medicine is where we've landed. A lot of regenerative medicine practices or practices that have multiple income streams coming to them. And so that's kind of been a neat space for us to hang out in because I'm kind of a patient. You can't recommend something without knowing if it works, right? And so, a couple of my experiences was, as we came on before, is I had an accident last year that severed a tendon in the top of my foot, and they sewed it up. 12 weeks later, they said, okay, you're good to go. And it just wasn't moving. My toe, the ligament on top of your toe came because of an accident that happened getting out of the shower. No, I wasn't break dancing getting out of the shower. Getting out of the shower, glass broke, severed the tendon, 2 tendons on the top of my toe. And after they fixed it, my toes were just flat. You can move your toe up and down. I couldn't move them up and down. So I went out to see one of my regenerative medicine docs. He says, oh, I got some things for you. I said, oh, really? And so he figured out how to shoot some things in my foot that were more on the regenerative side. And before that, I was not running. I was walking, but with a little bit of a gimp. Within a week, I was running sprints again.
That's fascinating.
So now it was tough to get because there's not a lot of ligaments. There's not a lot of fat on the top of your foot. Mm-hmm. And so he gave me a towel and says, bite this. This is not gonna feel great. He goes, but it will work. Mm-hmm. And sure enough, it worked. So I would recommend, the regenerative medicine outlook on when you're getting ligaments redone and, how do you get back to the game a lot faster in the game of life, walking, running, working out, the things that keep us alive.
As you age, the worst thing you can do is stay idle and let your body atrophy, and you get an injury and you can't break out of that.
Right.
So you talk about Western medicine, which I think everybody understands means more sort of after the fact, reactive, sick care, basically, right? Yeah. Using medications, using surgeries. And when you say regenerative medicine, just for our viewers, could you define really what does that encompass? And how is that different from Western medicine?
Yeah. Well, from my understanding, because I'm not a regenerative medicine professional, right, is the idea of letting the body heal itself. So many of the things like peptides and stem cells are things that actually are already in our body or have been in our body for a period of time. But as we age, it starts to get lower and lower and lower, similar to testosterone levels. And so recently I was having this conversation with someone about TRT, testosterone replacement therapy. And I was just curious. They say when you turn 50, a couple things you should do is get a colonoscopy, check it out, make sure there's no problems. And so I did that one, check, boom, felt good about that, which is a whole nother conversation because most men say, I'm not going to do it.
My mom died of colon cancer at 56 years old.
Wow.
So colonoscopies are a really good idea.
Yeah.
Easy way to save your life.
Yeah. So I went and did it, found out. I was scared because of all the stigma and whatnot, but didn't know what to expect. But it plays really well, as an African-American male, it plays really well that is a perpetual thing that happens in the minority community that, quite frankly,
goes
goes
there's
unrecognized.
a higher incidence of it.
Yeah. So did that, and then, they said, well, definitely got to test your man goods. I said, what's that? They said, your testosterone. I said, okay, great. So I said, mine's good. I work out 5 days a week. I'm doing. I've transitioned into I'm a recovering athlete now, but in my head I can still do it. So, I do boxing now, so it's kind of fun, And so I tested, and so people can look this up, but the average age, for my average age, I'm 50 years old, and they said my numbers should be somewhere between 400 and 500, my numbers. We were young, we were at 1,200, we were a little more agile and mobile. But my number was right at 453. But there's also what people don't know is your free testosterone too. And so that number ranges from 1 all the way up to 9 or 10. And my number was right around 3. And so from my understanding, that's the testosterone that you can actually use.
Okay.
That floats through your blood, and when you activate it, your ability to be at your best on command, you can use it. Mm-hmm. And so they started me on, at 50 years old, the idea of enhancing my testosterone level. So it's been an interesting project to kind of see and understand what that means. But I feel good. I feel like I'm not as lethargic and tired as I was before. We get to a stage where you're just you're not as sharp as you were, not as motivated as you were, and as athletes, you're always trying to tap into that piece of your brain that allows you to get back to where you were when people were calling your name when they come out and popcorn popping, and how do I relive the glory days, right?
Right. So how long was it before you felt different after you started doing this TRT?
Probably 4 weeks.
Okay.
4 weeks.
Mm-hmm.
Problem.
And this is not something that insurance pays for. This
Absolutely not.
Okay.
No, but it was something. Actually, insurance does pay for it if it gets what they call critically low.
Okay.
So in my 50s, they told me for insurance to pay for it, it would have had to be in the 20s. It would have had to be in the 200s or lower.
Okay.
So that's a significant drop off from even where I was. And I was
basically
at 400.
saying your body is deficient to a level of like having a health risk versus more of the feeling good.
Yeah.
Is that right?
Yeah. Feeling good, plus, your ability to sleep. I've noticed that since I've started taking it, that I'm sleeping like a baby again.
Mm-hmm.
I go to sleep at 9:30, wake up at 4:45, like clockwork, and I'm ready to go. Mm-hmm. It doesn't take as long to get going. But the biggest thing I notice is after eating, you don't have as much of a downside to after you eat, right? Is that you're not tired right away. So it's taken a little bit of time, but I can definitely feel the difference. So that's on the regenerative side is being proactive versus reactive, packing before you go on vacation versus waiting until you get there to pack.
Right. So it's a booming business, thinking about the business of healthcare,
It is.
this space of, and it's all cash pay, right? Mostly cash
Mostly,
pay.
yeah.
You said some exceptions
Yeah.
where maybe you had, I don't know, cancer treatment and it destroyed some of your glands or something, so you can't produce testosterone.
Yeah.
But so if you're basically, it's medicine for people who can afford to be proactive to that level. Is that fair?
Yeah.
Okay.
Definitely.
And the people that you see in that business, are they typically folks who were already doctors and they decided this was a way that they could, as you said, make an impact on patients' lives without cutting or doing the traditional kinds of medications? Or are you seeing people who are entrepreneurs that come from different backgrounds that aren't doctors already, that are doing this kind of, running these businesses?
Right. So from my understanding of some of the practices that we've been involved in the setup is that a physician, because of the ability to prescribe medication, has to be on record as a majority owner or a partial owner of the company.
Okay.
So then you've seen other people that understand the business of medicine getting involved with the doctor. But a lot of it's nurse practitioners, a lot of it's other healthcare professionals around medicine. But the one I mentioned earlier, he's a physician. He's been a practicing internal medicine physician for years.
Right.
Another one I work very closely with is a very prominent orthopedic surgeon out of Atlanta.
Okay.
And he's done some amazing things in the regenerative space as it deals with getting athletes back on the field, getting them back where they need to be successful.
And does that include stem cell treatments, those sorts of?
Yes. Yes. So some stem cell treatments, but the idea of other types of treatments that go along with it, like PRP and some other treatments that go along with that. You got red light therapy. You got a bunch of different things that go along with that. Getting the IVs done for hydration.
Okay. Interesting. Yeah.
What they call the superhuman protocol. Who doesn't want to be superhuman?
Right. Yeah.
Come on. That's the best part about it.
Sounds pretty good. Hook me up.
Yeah.
So if you zoom out into this world, though, of what I would consider broadly functional medicine, where there are different supplements and things that you also would take, like, is that part of the kinds of docs that you or regenerative programs that you're familiar with that you see being built? Do they include an assessment of your overall blood testing and microbiome and looking at the entire system?
Yep. Yeah. So the first part about going is finding a physician I like a physician-oriented practice because they've been to the other side and back, right? I love that idea because they actually can see the effects of what medication can do. Like, I'll give you an example. When I turned 44 years old, they diagnosed me with high blood pressure and never have had it before. And they said, you can't fight heredity. And I'm like, really? Let's see, I work out all the time. I play basketball. What's the story here? And they said, well, here, take this medication. And I said, I don't want to be on medication the rest of my life. I said, so I bet my doctor, I bet I can get off of this medication within 12 months. He's like, no, that's not going to happen. Literally within 12 months. I completely changed the way I eat, completely changed the way I work out, there's nothing that I bought that was outside of a home. I made everything, took salt completely out of my diet, double dosed the water. I did all the things. And my blood pressure dropped from what they call borderline hypertension to hypotensive, which is too low.
Yeah.
He's like, what are you doing?
Right.
How did you do that?
Yeah.
And I said, I told you I wouldn't be taking this medication.
Right.
So,
well, you were one of the individuals who was willing to make changes to your daily routine in order to drive that change versus most people or many people don't, for one, know that those changes can have such a dramatic effect, and two, maybe don't have the discipline to do it.
Right. Well, being an athlete did help.
Right.
Right. But we all know that at the end of the day, we want to be here for our kids. Right. And if you just think about, like, selflessly, we want to be here to make their lives a little bit better. And we're probably not ready to go when it's our time. Right. And so if anything we can do to elongate our lives, make it a better place and be able to experience those things for our kids and make the world a little bit a better place with less people on medication, it's kind of a good thing. Right.
No, absolutely. Well, that's fascinating, and I appreciate your candor also about the things that you've done. You have firsthand experience. So shifting to a completely other side of healthcare that you've had experience with, and I think this probably somewhat relates to you having been an athlete, is concussions.
Yeah.
So you hear a lot about it in football. I think actually, though, there are even more concussions than other sports, but maybe it's not as publicized. I think soccer has a lot. But what is your experience in that world? What has been done with the program you've been part of to try to deal with concussions as an aspect of sports? So
you probably heard of Chris Nowinski, who is part of the concussion protocol and concussion bank. He testified in front of Congress, former NFL, WWE star. You know, he's everywhere, right? And he launched a concussion awareness program that went nationwide, and there happens to be a chapter here in Chicago. I was heavily involved in that, one, because, you know, everybody, it takes a village to raise kids, and why wouldn't we want to make the sports better for our kids, right? That's number one. Number two is the more and more I thought about it, my son kept tapping me on the shoulder about playing football. You know, he played football from the time he was a little guy and played all the way through college, right? And so the idea of him going out there and, as a parent, not knowing how to help him, you know, that challenged me in a way where I said, you know, I at least want to be educated so then I can empower him to make some decisions, because when it's time to go back in the game, you know, they tap him on the shoulder. If he doesn't feel right, he's not going to have the courage to say to his coach, "I'm not going back in."
Right. Yeah.
You probably had, when you were growing up, if you played football or did anything, you had what they call stingers, or they
played through college, and I remember in high school, one of my best friends had caught a pass for a touchdown and got lit up by the defender. Came over to the sidelines and had this kind of glassy look in his eyes, and really wasn't interactive, and went into at halftime, came back out, played the whole second half, and didn't remember any of it. Yeah. And back then it wasn't as understood, like how problematic that is. Yeah.
And so now, you know, CTE is a real thing. Obviously, it's been tested. They found it in people that have passed away with head injuries, specifically a lot of football players. But one of the most dangerous sports is actually women's soccer. And they're hitting their head with a ball.
Right.
But it's more pronounced because of the game of football.
Right.
So we see it a lot.
And you see the violent,
we see it a lot more
collisions in football.
It's a gladiator sport.
Yeah.
People love watching it. It's entertaining. Ones you don't see is I've had concussions numerous times from playing in the Big Ten.
Right.
And playing against guys that are 7 foot and getting an elbow and literally getting knocked out on your feet.
Right. Yeah.
And day's over, and they're like, "Are you okay?" And you know what? You don't want to lose playing time.
Right.
So you know what you say?
Sure.
You say,
"I'm fine.
Yeah, I'm good. I'm going back."
Right.
You may not remember the play, but you're going back.
Right. Yeah. No, I'm with you. Yeah. So really, what you've focused on then is on the protocols to help to minimize the brain injury impact by making sure there's screening and education. Correct. Versus any kind of technology, or like I've read about and seen some of the new helmet technology that comes out every year in the NFL and the NCAA. Is that an aspect of the concussion? And I'm thinking also about where are the businesses and innovations that are happening to try to address this issue.
Right. So one of the big things that's going on is the timeline and the protocol for going back to play.
Okay.
Right. Is before it was a week. Before it was a couple days, depending on what kind of protocol there was. Well, now they're seeing that those protocols are short. And so someone with what they call a mild concussion, all the way up to what you saw Tua with, and which is a severity concussion that keeps coming back because perhaps he went back too soon.
Right.
But there's in ranges of anywhere in between that. And so you're seeing a lot of changes, but, you know, red light therapy, you know, they'll do red light therapy now on the head that will heal the brain and reduce inflammation. So they're doing some things like that. That's one thing that I've seen work. Also, they're doing some different stimulations to the brain also to help it heal and to sit back in its pocket and do those things. So there's a lot. There's a lot happening.
So there's some sports medicine that's happening to actually help you get back safely more quickly than if you just rest.
Yes.
Okay.
And when people rest, they do recommend things that don't create rapid eye movement. And so most people don't realize what the rapid eye movement is, but you know, you watching TV, they say it's completely sit in the dark. And so you think about kids and think about people. They're like, okay, I'm bored. I'm just laying here.
Right.
And it's like, no.
Well, now they're swiping through
their phone,
social or whatever, and it's really lighting up these areas of their brain that just need to rest.
And so I would just simply tell people that they have to take a different approach to what we thought, you know, medicine was before and what they thought regenerative medicine was before and what they thought about getting better. They have to just take a holistic approach to it and say, how do I become a better version of myself? Not today or a week from now, getting back to play, but how do I become the best version of myself from a health perspective for the future?
Right, because there's a long journey ahead.
Yeah.
Well, it sounds like you've built an amazing program at Midwest Legacy that allows your clients to be healthy both financially and physically. So congratulations on that.
Thanks,
and
I appreciate
if folks wanted to find you, where would they go?
They could go to the website at MidwestLegacyGroupLLC.com. They can find us there. Or you can find us on socials under Legacy Wealth.
Okay.
And we're out there.
And you have a podcast.
And we do. And so I'm a part of the association. I believe in giving back to everybody who's in the financial services industry. So I'm heavily involved in our association.
Okay.
And I host one of those podcasts that's on Apple Music and a couple other places you can find it, called Advisor Today. So it interviews the top innovative advisors around the country and puts them on a platform to make the world a better place for people living out their lives and finding financial literacy.
Okay, that's awesome. Well, thanks a lot, Chris.
I appreciate it.
So now we're transitioning to the verdict with Emily to talk through the legal and regulatory implications of regenerative medicine and other aspects of the conversation we had with Chris. It was great to have our guest, Chris Gandy, on, former NBA player, basketball star who's turned into a czar on how to live a great life and connecting the dots between health and financial success. And we talked a lot about this longevity idea and regenerative medicine. There's a huge boom in this. And back in the studio here, I've got our resident legal and regulatory expert, Emily, for the verdict with Emily to talk about what is the right way to get into business on this regenerative boom. Because it sounds like Chris is dealing with a lot of people who are doing it the right way as his clients and also his caregivers. But I think there are some people out there that maybe aren't doing it the right way. What should you do to make sure that you're set up for success and you're compliant if you're getting into regenerative medicine?
Yeah, it's a good question. So there are a lot of folks who are not doing it the right way. It's a bit of the wild, wild west out there. What's interesting about regenerative medicine is it typically falls out of the usual federal framework for healthcare rules and regulations. So you don't necessarily have all of the constraints that you do under like the Stark Law and the anti-kickback statute, but you're still subject to those state considerations. Where I see clients get it wrong is, like Chris talked about, you have to have a physician who is overseeing everything. In like the TRT space, we see a lot of folks only working with pharmacists, right? So one, does the pharmacist actually have the license, the scope of practice ability in their state to perform these services? So that I think that's one of the gating issues is it set up correctly from a licensure perspective? Chris even touched on ownership, right? So a lot of states have what's known as corporate practice of medicine considerations. So who can even own these clinics?
Like you have to be a doctor
You have
or
to be
you
a
have to have
doctor.
a medical degree.
Some sort of licensed professional. It varies by state. So
maybe in some states you can be a nurse practitioner.
Correct.
And if you have the credentials to prescribe, you could own one of these.
it's not even going to be the credentials to prescribe. I mean, I guess, yes, you'd be a registered professional in that capacity, but who can own it is going to be driven by the business regulations and the statutes in that state. And it's going to be specifically tailored to what type of clinic is this, right? So it is going to vary based on the clinics and the states. The other issue that we see come up a lot, and I have a client dealing with this right now, is there's a pharmacy component to it when you're talking about prescription for TRT and other regenerative type prescriptions. Where are these medications coming from? And so the pharmacy world, for those who don't know it, is highly regulated, and there are serious and significant ramifications for not getting distribution of pharmaceutical medications, devices, et cetera, correct. The states regulate the prescription medicine. They also regulate dispensing devices. And so you have to look at each state in which you're operating and also each state in which the patient is located. And oftentimes, if you as an entity are receiving medication and redistributing it, even though it seems silly, like from a business perspective, I'm just receiving something and sending it back out. I'm not actually doing anything to it. That can still be considered reshipping, and you have registration requirements with the Board of Pharmacy.
Okay, so if you want to be in regenerative medicine, you have to understand the state regulatory environment and the federal regulations and laws.
Yep.
And then you also need to ensure that the healthcare professionals or these regenerative experts have the right level of credentials to do the work. Like what's the worst, in just layman's terms, what's the worst offender that you can think of who is in regenerative medicine that looks like they're legit, but if I'm actually looking to be a patient potentially, what questions do I want to ask to see, like, is this actually a real kind of outfit I'd want to have them help me with, with this?
Yeah, it is a great question. I think it's really hard for a patient to know, but certainly ask their qualifications. You can ask for their business plan, and you can vet it past your primary care provider. Those folks should have a better understanding of what might be legitimate versus illegitimate.
That seems like a good idea, especially if the primary care provider is more progressive, because there certainly are primary care providers who really aren't interested in anything other than just the standard status quo. For me personally, I buy into functional medicine and have felt fantastic since I've gotten more proactive about testing and ensuring that I've got all the kinds of supplements that I need. And I think in this case, it's really going to that ultimate extreme of what are all the things that you can do. In my world, I am not injecting anything or doing anything from a treatment perspective. But hearing from Chris, it sounds like the TRT has worked out great for him. And I think that it's worked out well for others. Also, I've seen recent articles that describe like more of the horror story side where somebody doesn't actually really need that and then they get it and then it creates mood issues. And so clearly there's a right way and a wrong way, and not all regenerative medicine is created equal.
Yeah, I think it is, to that point, especially important to consult with your primary care physician. And if you have like specific issues that are wrong with you, cardiology, dialysis, things like that, you don't want to be taking any of those types of medications without consulting those specialists.
Okay, and so if you're an entrepreneur, make sure that you are checking all these boxes and have the right guidance, because you probably could go to jail if you did it wrong. Is that fair? Okay.
Absolutely.
All right. Well, it's awesome that we have these kinds of options out there, and also great to hear the perspective on what's the right way to do it and what are the warning signs that you should look out for. So thanks so much for being here as our resident legal expert. And thanks everybody for joining us for The Verdict with Emily. Well, thanks again for being here for another episode of Bostic Health. It was fantastic to have our guest, Chris Gandy, on to talk about the intersection of sports and business and healthcare. And also great to have Emily here with us to talk through some of the legal and regulatory considerations of the booming regenerative health space. I'll see you next time when we'll have more fantastic guests on Bostic Health.